Who here knows someone that has dealt with substance abuse? According to the National Survey on Drug Use and Health, 19.7 million American adults aged 12 and older battled a substance use disorder in 2017. Today, I will be discussing why some drugs should be decriminalized and how this would affect drug abuse in the United States. Destigmatizing substance use, generating tax revenues, decreasing overcrowding of prisons, and some benefits of public safety and health could possibly decrease drug abuse in America. The first step would begin with destigmatizing substance use within society. Destigmatizing drugs can change society's perspective about how we think about drug use. Drug use will no longer be a criminal issue, but should be treated as a health and social one. Destigmatizing these negative views towards drugs can reshape the way our family, friends, and medical professions think about drugs. Reducing the stigma can encourage people to talk freely and honestly to doctors about prescription-based therapies and could potentially reduce the overdosing crisis that is happening with a lot of college students, with a lot of young adults, with a lot of adults. It's just a type of issue that is reoccurring and no one is doing anything to stop it. In an event of an overdose, if destigmatization of substance use were to occur, then this could encourage people to call 911 at a scene of an overdose. Instead of fearing of the police, the fear of the police is a barrier and a deterrent in drug abuse occurrences. Generating tax revenues from drugs can save the government money, which can be applied to many drug abuse treatment programs that could potentially help people out who have problems with drugs and who have problems with addiction and drug abuse. For example, in all states in the U.S., if all states in the U.S. were to decriminalize marijuana, then this could allow people who are arrested with small number of drugs to avoid going to trial and or reduce the amount of jail time by paying a $100 fine and attending recovery programs. If less people were arrested for small drug possessions, then there would be less police funding needed. After the decriminalization of marijuana, then it would potentially be legalized in the future, and then the government could implement tax revenues on marijuana. This saved money, and collected tax revenues could be applied to drug abuse programs or treatment programs for people that suffer with addiction, like I said. If some drugs were to be decriminalized, then this would reduce the number of arrests due to small drug possessions and will eventually decrease the overcrowding in prisons. Decriminalizing these victimless crimes of the small possession of drugs could reduce the U.S. prison population without adversely affecting public safety. The drug category constitutes the largest offense category, with 31% of all prison admissions resulting from such crimes of drug possessions. If common illegal drugs like marijuana, cocaine, heroin, and LSD were to be decriminalized, then these drugs should be regulated by Food and Drug Administration for safety, along with many other drugs that possibly could be decriminalized. Money can be collected by heavily taxing these drugs, like how alcohol and cigarettes are currently taxed. So if potentially a marijuana could be legalized, then the government could put a large tax on marijuana, like how a lot of people are putting a lot of taxes on drugs. A lot of people are putting taxes on alcohol and cigarettes. If drugs were to be decriminalized in the U.S., then comparing some statistics from countries that have reduced or abolished criminal penalties for drug possessions have progressive change within their communities. Some of these changes include the rate of drug use did not increase, the rate of addiction, overdose, and HIV and or AIDS sharply decreased, and more people entered drug treatment programs. The decriminalization of drugs in other countries have lowered overdoses and disease rates, while increasing people's access to social services and healthcare that is now readily available, since the stigma barrier around substance use would be gone. Drug abuse victims can now be more open about their habits and problems to receive help. Without this barrier, people would not be so hesitant about talking about their problems with substance abuse. Since substance abuse is so looked down upon now in society due to it being illegal, many people would be afraid to talk about their problems and how they should recover from these problems of overdosing, of drug abuse, of addiction, of all types of problems within using these drugs. Overall, decriminalizing drugs can destigmatize substance use, generate tax revenues, decrease overcrowding in prisons, and will benefit the public safety and health of people who struggle with addiction and drug abuse. Using all of this information, hopefully this will bring awareness to decriminalizing drugs in the U.S. Decriminalizing drugs will be helpful to those suffering from the dangers of substance use and will be able to speak openly about their relationship with drug abuse.